My name is Marianne Borkert, and I'm with Aging at Home Fairbanks, a member organization offering support for older adults to live independently. And when we at AAH realized that Falls Prevention Awareness Week was coming up, we thought this was a good, great message for our members and also for the community. So we set up this series of events this week. So every afternoon at 4 o'clock, we'll have different speakers. And let me share my screen here. So we are really pleased to have so many different people here to speak to you. And excuse me while find my beginning here. As I said, the meeting is being recorded. Everybody should be on mute and no video. We will have questions at the end. And if you have questions as we go along, you could write them in the chat and we'll either read them out or and ask the speaker at the end, or you can raise your hand, which on this, oh, I can't see now that I've got my screen here. So there is either a raise hand icon at the bottom or in reactions, I think there's a raise hand. And we can call on you and you can ask the question directly. As I said, you might want to put this on speaker view when somebody is talking, but when the screen is shared, you're going to get the whole screen anyway. So we are very happy to have you here. And the Aging at Home does a lot of things. I'm not going to talk all about that now, but we today are here to talk about falls. And we know that there are a lot of different kinds of falls. One of them is falls with a lot of water, such as Niagara Falls. There are also falls with a lot of color, such as Fairbanks Falls. And this year, I think it's been especially beautiful. Didn't like seeing the snow this morning, but the fall colors are still there. But we're going to be talking about people falls this week, because falls are serious and costly, and they hurt. And they're the greatest cause of injuries for people over age 65 in the US. So they're pretty important, and they can be prevented. So the National Council on Aging set 1 week in September each year for Falls Prevention Awareness Week. And we decided to take advantage of the whole week and give you different presentations. And there's a proclamation from the borough mayors that says that this is Falls Prevention Awareness Week here in Fairbanks and the borough. So spread the word, folks, because we want you to stand tall and don't fall. That's our message for the week. So I am going to stop sharing my screen. And our speaker today is Dr. Daniel Mccauley. He is in internal medicine and geriatric medicine at Tanana Valley Clinic and the Denali Center. He's originally from Alaska, or grew up in Alaska, but is back now and we're really glad to have him. So Dr. McCulley, if you want to take over, we're glad to have you.
Great. All right. Thank you, everybody. Let me see. I'm going to go ahead and share the screen, have a PowerPoint, and I believe I'm going to provide the PowerPoint. And so probably don't have to do a bunch of notes if you don't want to. You should be able to get this at some point. All right. I'm going to try to share it. It should be loading up there. So yes, I'm Daniel Mccauley. I'm a geriatrician. I'm at TVC half the time and Denali Center half the time, where I see a lot of patients, and I'm medical director over there. So falls is definitely something I see quite a bit. It's one of the big reasons people end up coming to Denali Center for short term is falls and hip fractures, kind of being over there for short term rehab. So we see it quite a bit. So going to spend some time talking today a little bit about kind of what falls are, why they happen, and why older people especially are at risk of falls as you get older. So let me go ahead and so introduction, we're going to share a few statistics with you. We're going to spend most of this talking about the different kinds of risk factors, just so you're aware of the things that make people more likely to fall. Then I'll give some general tips for fall prevention. I'm not going to go into a huge amount of details because we're going to have a lot of good speakers throughout the rest of the week, which are going to go into more details, but kind of just going to hit what I think are some of the most important things for people to know. And then I'll also talk about a couple local resources and resources on the internet as well that I think are pretty helpful for people to review. So the falls definition is basically an event which results in a person resting inadvertently on the ground or another level. There's a lot of different kinds of falls. There's tripping falls, there's passing out falls, but this is the kind of the basic definition of a fall. Falls are pretty common as people get older. So when you look about in the last year, about 1 out of every 4 people over the age of 65 has fallen. And the older you are, the more likely you are to have a fall. So about 1/3 of people over 85 have had a fall in the last year. And why this is important is because there's a lot of money that goes into falls. There's a lot of suffering that goes into falls. So there's about 3 million people a year who are treated in emergency department for falls, about 800,000 a year who are hospitalized, and about 300,000 people are hospitalized for hip fractures, and almost all of those are from falls. Also see falls causing traumatic brain injuries, people having bleeding in the brain or concussions that can increase their risk of memory changes as well. And it's quite expensive. So we're going to talk more about the risk factors. That's kind of the focus on the talk today is why do people in their 60s and older fall at such a high rate compared to people in their 20s and 30s? And certainly some of that has to do with just the age-related changes. So the changes that come about in the aging body. Other things come along with the diseases that can come along as people get older. There's also a lot of medications that can increase the risk of falls, and then things that are outside of the person, things in the environment as well. So these are kind of the 4 categories of things that cause people to fall. So we'll start with the age-related changes. So one of the big things is hearing changes. So a lot of times as people get older, they start to have hearing loss, ringing in the ears, kind of problems with what's called the vestibular system in the ear, and that increases the risk of falls. One of the other things is vision changes. So it's very common for people as they get older, especially to have cataracts, and cataracts are one of the biggest causes of falls. So it seems like people, once you get cataract surgery, your risk of falling actually goes down a fairly significant amount after that, getting just that first cataract corrected. There's a lot of balance changes that go along as people get older. Kind of the way the muscles work is they don't always work quite as well as they used to. And sometimes you can't catch yourself as fast as you did before, which also plays into the slower reaction time. We also know that as people get older, a lot of times the thirst center in the brain doesn't kick in as quickly as it did before, and people can get more dehydrated before they feel thirsty. So it's not uncommon for older people to not have that sensation to drink as much and get a little bit dehydrated, and even just being a little dehydrated can make your balance get thrown off. For most people, when we stand up, we go from lying to sitting or from sitting to standing, our blood pressure usually drops a little bit, and then the body kicks in some mechanisms to raise the blood pressure back up. A lot of times as people get older, it takes longer for those blood pressure changes to happen. So people can stand up and their blood pressure can stay down or go lower than it did before, and they can feel quite dizzy. And when the brain isn't getting enough blood flow, one of the ways it gets blood flow is by making people pass out. So then the body is not having to pump against gravity to get blood to the brain. So the brain wants to protect itself, and if falling and breaking a hip is the fastest way to get blood to the brain, unfortunately, that's what happens sometimes. Another thing to think about is what's called sarcopenia. So sarcopenia is just as people get older, a lot of times they lose some muscle mass. And that's not just muscle mass. So the muscles go down, the numbers of muscle fibers usually stay the same, but they get smaller. There can be some scarring in there where they don't work quite as well as before. And a lot of times as people get older, they also have issues with more fatty infiltration into the muscle, so it doesn't really work as well. So, based on some studies, once you get into your 30s, a lot of people are losing between 3 to 5% of their muscle every 10 years. So the older you get, the more muscle you're losing. It's not uncommon for people to lose, 30, 40, even 50% of their muscle towards the end of their life compared to what they had in their 20s and 30s. This is for a long time been thought as kind of a normal part of aging, but there's more and more research showing that people that eat enough protein and are doing weight training and keeping themselves really active actually seem like they have less of these changes, less of the scarring in the muscle, and less of the muscle kind of being replaced by fat. So we'll come back to that in a little bit when we talk about some of the important things we can do to help decrease our risk of falling. The next category for risk factors for falling is chronic diseases. So as people get older, the risk increases for any number of different conditions. There's a lot of these conditions that do increase the risk of falls. So this is just a partial list of what could be a much longer list, but some of the most common things are arthritis. People with any kind of osteoarthritis, rheumatoid arthritis, regular osteoarthritis, where you think of the wear and tear, arthritis are at higher risks for falls. People with heart issues are also at higher risk for falls. Anything that kind of affects the brain can really increase the risk for falls. So most of the forms of dementia, eventually at least, will affect some of the balance centers in the brain and increase the risk for falls. People with diabetes can have falls for a lot of reasons. It can be from low blood sugar, can be from high blood sugar, and a lot of times people with diabetes have changes in the nerves in their feet, get what it's called peripheral neuropathy, where they don't have good sensation in their feet. And if you don't have good sensation in your feet, the brain has a hard time figuring out kind of where your feet are in space, and it can certainly affect the balance. Parkinson's disease gets more common as people get older, which kind of affect the balance, the muscles. And then strokes is another big cause of things that affect the body. So it can affect your ability to use one side of your body. You can have strokes in some of the balance centers in the brain and the brainstem. So those are just a few of the chronic diseases that get older, that as people get older, become more common and increase the risk of falls. So medications is another big category of things that increase the risk factor, that increase your risk of falling. There's a lot of different medications. One thing we know is that it seems like no matter what medications you're on, if you're on 4 or more prescription medications, you seem like you're at a higher risk for falling. It's not clear exactly why that is. It could just be people on 4 or more medications a lot of times have more medical issues. So they may have the stroke and, history of the stroke or history of heart issues or dementia. There's probably some interactions with the medications as well. If you have one medication's doing one thing and it's not causing side effects, another medication maybe will make that other medication start to have side effects when they work together. So some of the big medications that are correlated with increase of fall risks are what we call the anticholinergic medications. So a lot of these can be bought over the counter. So I have patients quite a bit that think if you can buy it over the counter, it means it's safe, and that's not necessarily the case. So most of the allergy medications, but especially things like Benadryl or diphenhydramine is the generic name for it, or Zyrtec or cetirizine is the generic name for that one. They can affect the balance, especially if you're using them regularly. Most of the over-the-counter sleep medications, so almost anything with PM at the end, the Tylenol PM and the Advil PM, those usually have Benadryl in it or something related to Benadryl. There are a few different antidepressants, which also can have these anticholinergic properties, which increase the risk of falls. And almost all of the prescription bladder medications that people use for incontinence can also increase the risk of falls. And in some studies, increase the risk of dementia as well. So certainly not telling people to just, stop the medication the doctors put you on, but if you're starting to have issues with falls or unsteadiness, sometimes we talk to people and we talk about trying to go on a little lower doses of these medications, trying alternatives. And sometimes, we can stop these medications altogether and people really weren't getting much benefit from it. Maybe we're having side effects. So for example, the bladder medications, I'd say probably about half the time when I have people stop them, they really don't notice any difference. So it may be that it helped, they've been on it for 12 years, it helped for a couple of years, and maybe at some point it's really stopped helping and is increasing the risk of falls and memory issues. So the next category of medications that does increase the risk of falls is most of the prescription sleep medications. So Ambien, especially, in all the medications that are in that class. Pretty much any of those increase the risk of falls. And if you look at the studies, increase the risk of fall with a hip fracture, especially. So you can have real serious falls from these medications. Really, the sleep medications don't have good evidence that they help a lot in the long term. You really become addicted to them and don't have significant improvement in sleep, really. It's just your brain kind of becomes dependent on them, can't really sleep without it, but it's not really helping you too much. The other classes of medications also increase the risk of falls quite a bit. So almost any of the medications that make you feel good end up increasing the risk of falls, unfortunately. So opioids are a big class of medications. The benzodiazepines, which are medications that are used mostly for anxiety, also increase the risk of falls, especially when you're taking them regularly. There are some other medications, gabapentin and pregabalin are ones that a lot of times people use for chronic pain or for neuropathy, painful neuropathy in the feet. At high doses especially, or if people have kidney issues, these medications can increase the risk of falls. And then the other classes, most of the muscle, or really all of the muscle relaxants, the way they work is they relax the muscles, but they also kind of decrease your reflexes and can cause a little bit of confusion and slowing reaction time. So it can increase the risk of falls as well. So beyond just prescription medications or over-the-counter medications, other things is alcohol. So, I have patients that are drinking quite a bit more than is recommended and can't figure out why they're falling. So even if that's not 100% of the reason, it certainly could be part of it for some people. And especially here in Fairbanks in Alaska, there's a lot of older people are using cannabis products. So we could kind of talk about what the evidence for and against that is. There's really not very much, but it does decrease your reaction time. It usually does slow people's kind of memory and coordination down. So especially people who are at risk of falls, cannabis is probably something that is best avoided or used in lower amounts. So the next kind of class is the extrinsic factor. So they're not things that are inside a person, but they're the kinds of things that are outside of people. So there's a lot of different things we could list here, but some of the big ones I see especially are listed here. One of the big ones is pets. So I would guess of the falls that I see, probably, I don't know, 10 to 25% of the time, people tell me they got tripped by their cat or their dog, either outside in the house, walking down the stairs and the dog ran into them. So pets are a big cause. So certainly not saying get rid of your pets, but just you have to realize that having a pet around does increase your risk of falling. The ice, obviously, in Fairbanks is a big risk for us. I fall pretty much every year. So on the ice, trying to do something outside or going skiing and not paying attention or whatever. Poor quality footwear is another big thing that a a lot of people don't really think about. So if you're falling or at risk of fall or real unsteady, walking around in your house in slippers or socks or sandals is probably not a good idea. So there's a little bit of controversy over what's the best shoe for not falling. Some people think you need kind of more cushion and a lot of stability. Other people say the real thin midsole is the like thin sole, a hard sole is better. What I think we can say is, you know, things like Crocs or slippers or sandals are probably not a good thing if you're at risk of a fall. What the American Geriatric Society has said, based on some studies, is that something like a good slip-resistant sole, a thinner, firm sole, not having a high heel, and kind of having good support is important. And I think this is kind of a good thing to start, at least a good way to start thinking about shoes. One thing I see quite a bit is when you actually look at the shoes people are wearing, a lot of times they're very appropriate shoes, but people wear them way beyond when they should, and the grip's totally gone. And they may as well, you know, be wearing something with no grip at all. So once that slip resistant sole is almost all the way worn out or all the way worn out, you really need to be switching out so you can still have some grip. One other thing is it's gotten really popular over the last few years to use the Hoka brand shoes. So they're real kind of thick cushioning. They can be really comfortable for people with arthritis. I like them when I run longer distances. I think they're very comfortable, but even when I wear them just kind of standing around or walking around, I do think because they're so tall and spongy, they do kind of throw your balance off a little bit. So you have to weigh the benefits. If it's really helping your arthritis, it certainly may be helpful to have that kind of Hoka type shoe with really thick, kind of soft cushioning. But it also may be something that if you're at risk of a fall, you could throw your balance off a little bit. So glasses is another big one that a lot of people don't really think about. So it can be very, very helpful to just have one pair of glasses where you use it for distance, and then you have your bifocals or your trifocals where you can just look down and read a little bit nearer. So there's bifocals, which usually have the line, or the trifocals, which usually have the two lines. And then there's the progressive lenses, which is similar, except they kind of blend into each other and you don't have that discrete line. But there's actually been quite a few studies that show people that are wearing bifocals or trifocals or the progressive lenses seem like they have a higher risk of falls than people who just have a reading pair of glasses and then a distance pair of glasses. So these are some pictures from a couple studies. The one on the left is they held up a progressive lens looking down the stairs. And what you can see is especially that lower part, which is more for reading, is really kind of warping where those stairs are. And it can make the stair look curved or a little bit set out from where it really is. So it'd be easy to see, especially if you're not paying a lot of attention, you can end up kind of misstepping and slipping down the stairs. The picture on the right is from another paper that talked about this issue. And so of the picture on the right, that left half is kind of with, if you just had a regular distance vision glasses, and you can kind of see that break in the concrete where it's raised up there, which would be a tripping hazard pretty well on the left. But over on the right, you can see this is a bifocal lens, and on the bottom is more for reading. So it's a little bit fuzzy and it'd be harder to tell kind of where you're sitting or where you're stepping. And it would be a lot easier to trip over that area if you weren't paying attention. So it's something to think about. For certain people, bifocal, or in certain circumstances, bifocals or trifocals may be a good idea, but we do know from the studies it can increase the risk of falling quite a bit. So one thing I think it's important for people to realize is that usually falls are due to multiple different things. So usually it's, you know, kind of a collection of risk factors all coming together. So a lot of times if you pick one thing to work on, it may not prevent a fall. You know, if you have really bad balance and you're on a lot of medications that are affecting the balance, and you have all kinds of tripping hazards around the house, but you get rid of bifocals, that may decrease your risk a little bit, but really you want to try to fix as many of the different factors as you can. Not just, you know, find the one thing and do that and expect that's going to make a difference, because usually there's a lot of different factors that are playing into it. So what we're going to do now is talk a little bit about some tips for fall prevention. So again, I'm not going to go through everything that's really important that everyone needs to know. There'll be a lot of other speakers that'll go into some detail, but these are some of the things that I think are kind of higher yield, real important things to think about. So preventing that sarcopenia or that age-related muscle loss. So like I said, people used to kind of think this is just you're going to lose 3 to 5% of your muscle going forward from your 30s, no matter what you do. And that's just kind of part of getting older. And I think that that view of aging has changed a lot when it comes to sarcopenia, and it's changed a lot when it comes to other things too. We know that there are a lot of things we can do to age more in a more healthy way. And aging is just, for most people, shouldn't just be a passive thing where you just kind of sit there and see what happens. There's a lot of things we can do to age better. So exercising regularly is real important, and we'll talk a little bit more about that on the next slide. And also eating enough protein. Usually older adults actually need to get more protein than they did when they were younger. This is a little bit controversial over exactly what the numbers are, but a lot of the nutrition experts recommend that for younger people, to kind of keep your muscle, you only need about 0.8 grams of protein per kilogram of weight per day. And for older adults, that probably goes up by about 50% to 1.2 grams of protein per day. And it seems like if you're not getting enough protein, you're more likely to lose your muscle as you get older. And a lot of times what we see in studies is someone who maintains the same weight throughout their life actually is usually replacing a lot of that muscle with adipose tissue, with fat. So someone who's been 170 pounds their whole life, especially if they're not exercising, not eating a lot of protein, they may stay at 170 pounds, but they may have lost 20 pounds of muscle and gained 20 pounds of fat. And the scale's kind of not very accurate when you're looking at kind of healthy body composition, if you're just looking at the number. So for the protein and kind of trying to keep your muscle, so for someone who's about 130 pounds, they'd recommend trying to get about 70 grams of protein a day, a little bit more than that. For someone 175 pounds, getting close to 100 grams of protein per day. And for someone 220 pounds, about 120 grams of protein per day. And depending on the studies you look at, of people over 65, probably less than half, or maybe around half of people are getting this level of protein per day, that 1.2 grams of protein per kilogram. So something to think about. Sometimes people ask me, does protein shakes help? I'm not sure. The studies are a little bit kind of contradictory, I think, on that, about how helpful just a protein shake is. It's probably better to get it from your food, but I don't think it's hurtful probably to do a protein shake if you need to make up some difference. So this is a slide that just talks about the physical activity goals. So I think this is one of the most important things for helping maintain your balance, your muscle, and prevent falls as you get older. And there's many other benefits of physical activity as well. So working out 150 to 300 minutes per week of moderate exercise, so it's about 30 minutes, 5 days a week, is something that's really important for your heart, your brain, and kind of overall. And of my patients who work out, usually they do a really good job with this. This is what people do. They, go on brisk walks or bike or do jogging or swim or whatever they want to do. But what a lot of people aren't doing to help maintain the muscle and decrease the risk of falling is strength training. So it is really important to do some kind of strength training. The recommendation is try to get most of your major muscle groups at least 2 days per week. We do know on average that with that sarcopenia, the average person is actually losing muscle. People that are strength training seem like they keep their muscle on, and actually as an older person, people can actually gain muscle too. So strength training's good. It doesn't have to be lifting really heavy weights. It can be the machines. It can be, push-ups and body weight squats. You don't have to go to a gym for this, but something that's really working the muscles is important. The other part of the government's recommendation for older adults is to include balance activities. They're a little bit vague on what this means, but some examples are things like Tai Chi or yoga can have balance components. There are things, if you work with a physical therapist or a personal trainer, they can kind of give you some specific balance activities and exercises that are most appropriate for you. Sometimes we have people, just kind of like stand behind a chair and balance on one foot. trying just to balance on the foot and then kind of holding the chair if they need to catch their balance. For someone with really bad balance, that may be difficult, and even just standing on one foot and kind of holding onto the chair maybe will help some with their balance. So one of the things we do in clinic sometimes is this chair rise test. So you can see kind of what's expected of being able to sit in a chair, stand up, sit down, and do that, and see how many times can you do that in a minute. So over on the right side here, there's what we would think of as the kind of standards, what we would hope people would be able to get to. So, you know, a person in their 60s should be able to sit at a chair, stand up, just using their legs, sit down, and do that 14 or more times in a minute. We know that people that are kind of under this below average score, it means they have weaker leg muscles and they're more likely to fall. For this test, actually what you do is you kind of put your right hand on your left shoulder and your left hand on your right shoulder, and you're standing up without using your hands at all. You're not pushing off and you're just using your legs. So this is a test we do sometimes in the clinic, not real often, but sometimes. I think physical therapists do this a little bit more than a lot of the doctors do. But you can actually do this on your own, and you can use your hands to get up. There's an exercise handout from the CDC. If you just search for chair rise exercise, they have kind of some of this and then more details. But if you're able to do this kind of 10 to 15 times, take a break and then do it, you know, for a couple minutes and then do it 10 to 15 times again. This can be something that really works on strengthening those muscles and that are so important for balance and just strength and preventing falls in the legs. So if you're doing this, 2-3 times a week, that's something that may help keep some of those important muscles in place. I mean, I think ideally people would be doing other exercises too, but I think if you were to pick one exercise as an older person to try to maintain strength in legs, this is a pretty good one. So a few other tips for falls prevention. We know that there's a lot of, with the age-related changes, that it's really important to get your vision checked regularly. So, you know, follow up with your eye doctor as often as they feel you should. If you're having a lot of balance issues, unsteadiness and falls, and you have cataracts, it's a good idea to ask, are these cataracts at a level where they should get changed or where we should get an operation? Because again, like I said before, even getting cataracts removed from one eye seem like they decrease the risk of a fall a fairly significant amount over the next year. Other things, treating macular degeneration, glaucoma, and helping to preserve your vision is really, really important. Staying hydrated, like we talked about before, is really important. So especially for an older person, if they're waiting to drink until they're thirsty, they may be getting dehydrated. I think they say that about younger people. That's pretty controversial, but because of the changes in the brain that go on, older people, a lot of times by the time they're thirsty, they probably are at least a little bit dehydrated. So kind of trying to make sure you're drinking enough water or other fluids regularly is important. Watching out for hearing changes is important as well. Like we talked about before, there's a lot of different kinds of hearing changes, but if people are asking you to repeat yourself a lot, you should probably get a hearing evaluation and see if you need hearing aids, because it does seem like the better you can hear, the lower your chances are of falls. For the chronic disease part, it is important to work with your doctor or other healthcare provider to manage those things. I'm not going to go obviously into details on all the different chronic issues and how we manage them, but we do know for things like diabetes that we want the blood sugar to be not too high and not too low, because either one of those extremes can increase the risk. And honestly, getting too low is more dangerous than getting too high in the short run, and especially when it comes to falls. So as people get older, a lot of times we do let the blood sugars run a little bit higher than we did when people were younger. So work with your doctor on that. Blood pressure is another kind of controversial subject about what should your goal be. So it's beyond the scope of this talk to talk about what the specific goal should be and why we say that. Excuse me, let me get a drink of water here. I think I'm getting dehydrated. Okay, so for the blood pressure, I think that a good goal for that systolic blood pressure is probably about 130s for most people. So kind of in that range of 130, 139. If you're getting a lot lower than that, then I think you're increasing your risk for falls. If you're getting a lot higher than that kind of 130 to 140 range, then you're probably starting to increase your risk of stroke than heart attacks. If you're on blood pressure medications, your blood pressure is running, 100, 110, that's probably too low for a lot of older people. Maybe someone who's in their 20s or 30s can handle that, but even that would be pretty low for someone without kind of all those changes that go about with aging. And then the other thing with chronic diseases is try to prevent them, or if you have them, treat them. And usually that's things like exercise and healthy diet, getting good quality sleep are really important to help treat and prevent chronic illnesses. A few other tips for fall prevention is when it comes to medications, if you're feeling pretty unsteady or having falls, you really should talk to your doctor about what medications you're on. Have them go through and talk to you about which of the medications you're on could be affecting your balance and which are increasing the risk for falls. And it doesn't mean you have to stop them. It might just be being aware of it. It might be talking about the risks and benefits and making sure that that medication is still helping you, or sometimes getting a trial with a lower dose or even stopping it and then seeing if it actually is helping you. And sometimes we can get people off of medications that they didn't really need to be on. And when you do talk to your healthcare provider, I think it's really important to tell them what over-the-counter medications you're on. So this is something I see all the time for my consults when I see consults for falls or memory issues, is a lot of times people are on over-the-counter medications that have a lot of side effects and they haven't told their doctor because they just assume, well, it's not a prescription medication, I can buy it in the store. So when you're talking, bring up all the medications you're on, making sure we can make sure there's not an interaction or just that medication is not very good for you. Avoid overusing alcohol and cannabis is certainly very important. And as far as my kind of big tips for the environmental or extrinsic factors, those factors outside of ourselves, is think about wearing really appropriate shoes. So if you're off balance, you probably shouldn't be running around in socks all day. And you probably shouldn't be wearing, sandals. So I see people in clinic all the time that are wearing, slippers outside, coming to the clinic in slippers because that's really comfortable and they have maybe issues that make other shoes uncomfortable for them. But that really is a very big tripping hazard. So if you think about getting some of those traction things to wear on ice, like the Yak Track or any of those other ones, especially in Alaska, a lot of people are falling on the ice. A lot of young people are falling on the ice too. But if you're an older person falling on the ice, your risk for a hip fracture is going up pretty high from falling hard on hard ice. And then certainly for a lot of people, I think if you can, it might be better to have a pair of reading glasses with you and have a pair of other glasses for distant vision if you need it, instead of having bifocals and trifocals. If you do want to wear bifocals, trifocals, just realize your risk of falls is going up. And especially when you're going down the stairs where there's kind of small changes in level, cracks in the sidewalk where one is 3 inches bigger than the other, it may be harder for you to see that if you're wearing bifocals or trifocals or some of those other kinds of lenses like that. So I'll bring up a few resources, again, not trying to be totally comprehensive on everything that is available, but there are a couple websites and then programs that I wanted to tell people about. So the Alaska Senior Fall Prevention website, the Department of Health here in Alaska, this was from Falls Week from I think a couple years ago is when they put a lot of this stuff up. But they have some good interviews and handouts and recommendations for exercise and kind of tips to look at. So I think that's a nice website that would be good for people to take a peek at if you're interested. The hospital rehabilitation center actually does have a balance screen program that's free for anyone over 55 or older. I know with everything going on with COVID, kind of some of the services have been available and not available. I think this one's still available last I heard. I don't think there's been a pause on this one with COVID. But especially before COVID, I had a lot of patients going in. I think they're probably not getting as many people interested in, but people are still falling. COVID, just because COVID's out there doesn't mean you don't need help to prevent a fall. So if someone's 55 or older and having issues with mobility, if they're worried about falls or having a fall, this is a good program. So you can go in and meet with them. Last I looked, they're kind of next to REI in the old Fred Meyer's building across from Safeway. So they bring people out there, and you'd have a therapist and some other people kind of review medications, do some exercises with you, do some balance training with you, and then kind of come up with a plan. And that plan might just be, here's a list of some exercises for you to do at home. It might be recommendations for more of a hearing evaluation. It might be actually working with physical therapy for a longer amount of time, repeated sessions to work on getting stronger. So I think it's a really good program, and something that more people probably in the community should take advantage of. There's a couple other websites. So the CDC has a nice fall prevention and fall education program that they do called Steady. There's a lot of good information for providers, and there's also sections for patients and caregivers. So if you just search online for CDC Steady, you'll find it. They have all kinds of different handouts and articles and things like that. So I think it's really good. As far as exercise, there is the National Institute of Health. Used to do this website called Go for Life. That website went away, and a lot of those materials went over to this other National Institute like exercise site. But if you search for Go for Life, you'll find it pretty easily. And they have some kind of how to get started with exercise, exercising with chronic conditions, and a few different articles that are pretty healthy. And then the other thing that may be helpful is Dr. Triplehorn, the sleep medicine doctor here at TVC, and myself did one of the UAF Healthy Living lecture series this summer. So we did a Healthy Living after 55. So it certainly wasn't just talking about falls, but really was talking about exercise, diet, healthy sleep, avoiding risky substances, and talking about kind of having meaning and purpose in your life, and some of the things that are especially important for people to think about as they get older. And that's a little longer lecture than this, focused more generally, but also there's a lot of recommendations for kind of the diet, some recommendations for exercise, apps and kind of the websites, and there's other resources there. So if you just search for the UF Healthy Living lecture series, you can find a link to it. It's on YouTube as well, and it may be helpful for some people. All right, so just to summarize, falls are a big problem for older people. It's costs about $50 billion a year. We're having getting close to 1 million people a year that are having to be hospitalized for serious falls and causing things from hip fractures and traumatic brain injuries and all kinds of other problems. So it is something that we want to understand. What is my risk factors for a fall, and what can I do to help prevent it? So we talked about a lot of different risk factors. Some of them come about as we get older. Some come about from chronic medical issues. Some about how the things in the environment around us, and then also the medications. So we talked about some tips, which hopefully will be helpful for some people, and then those resources. So a lot of good stuff online, and then also think about that the hospitals program, the balance screen program, that I think can be really helpful. All right, so that's the main talk today. Be happy to take any questions from anyone about falls or other geriatric issues if people want to. Oh, I think you're muted, Marianne. I can't hear you.
There we go. But some people don't want to drink water in the evening because it means they'll have to wake up and go to the bathroom. So what do you tell people about that?
So what I usually tell people is try to just drink the same much water, but shift when you're drinking it, because that's true. A lot of times people don't want to use the bathroom, so they just stop drinking after dinner, and that might be okay if you're getting enough water during the day. So a couple hours before bed, if you want to cut back on the fluids, that's probably a good idea for a lot of people that have bladder issues. But try to still drink during the day.
can we just ask questions like this?
Sure, I think that's okay. That's okay with me.
Okay. I'm 82 and I just forgot my question. That's horrible. But it was something about exercising. Do you have any suggestions for those of us that know we need to exercise and we don't get out there? What can we do to make ourselves do it other than knowing we have to?
Well, sometimes if you have someone who holds you accountable, it can be helpful. So if you have someone you can exercise with, or even just someone you know is going to ask you if you exercised. So if you have, a friend that you know is going to pester you and give you a little hard time if you didn't exercise that week, that may be helpful. Another thing is to be able to have an exercise that you can do easily in the winter. So if people can get like an exercise bike in their house, so where at least they can get a little exercise during the winter without having to get out and walk and slip on the ice, that could be a good idea. What I've had some of my patients do is buy these little exercise machines. They're called under desk exercise machines. So they're made for going under a desk and people can get a little exercise while they work. There's one called the QB that probably people have seen ads for, CUBII. And I've had some people get that and have felt like it's helpful. And actually, let me just, I'll share a screen and look at it. I'll show people real quick here. So I've had some people buy these and they felt like they've been pretty helpful. So to actually be able to get at least a little bit of exercise while they're actually in the bad weather. So you kind of see this is one brand, but it's basically just a little thing here. You can sit in your most comfortable chair and you can get at least a little bit of exercise, even if it's not the best exercise in the world.
Well, a corollary to that question is, if we are doing, hard work outside instead of the walking or the jogging, is that equivalent, or how can we make it? I have a small farm. I'm working hours and hours and gardening.
Mm-hmm. Yeah,
is that equivalent?
So that is equivalent, assuming you're working hard enough. Okay. One way to tell if you're getting up to a moderate level of exercise, so that's going to be different for everyone. Someone in the Olympics is going to be working out way harder than me to get to a moderate, or way less hard than me to get to a moderate level. I said that backwards, but you know what I mean. So as far as moderate level of exercise, usually that's defined as you can talk with someone. So you could have a conversation, but you couldn't sing a song. So if you could kind of sing a song while you're out working in the garden, you're probably not up to that moderate level of exercise. And that's kind of where you want to get up to. If you could have a conversation, but if you're trying to sing regularly and you couldn't, then you're probably up to that moderate level. And then the more vigorous exercise is usually if you can't even really have a conversation. You'd feel kind of too short of breath to have a normal conversation.
That's great.
So we have another question from the chat room.
Sure.
And that is, what is the best way to fall?
What is the best way to fall?
Not to do it.
Yeah. So the best way is not to do it. If you do have a fall, I guess it depends on where you are. So if you're going to fall, what you really need to do is be able to call for help if you need it. So ideally you wouldn't fall in the first place, but I've had people who have fallen outside, don't have a cell phone on them, and they can't get inside, in the winter and getting frostbitten. So try not to fall, do what you can. And if you are at a risk of a fall, make sure you have a cell phone on you. If you don't have a cell phone, there's all those kind of life alert and those kind of things you can do. There's actually the iWatches, the Apple Watches, have technology in them where they can sense a fall. And then you can actually do a call from the watch, or it can send an alert to someone who you've set up if you do have a fall. So those are options too.
I was thinking perhaps she was referring to how your body should go. I know I fell playing pickleball and was rolling, landing on my butt when I was going backwards and rolling up my head so my head didn't hit.
Yeah. Oh, okay. I think that's a good question. So, yeah. So don't hit your head is probably the best, the best advice. So if you can do it, if you're gonna fall and you can hold on to something to kind of slowly lower yourself down, that's much preferable. So it kind of depends on the situation or what happens. You know, most falls, they're over. People can't really plan for them though. So preventing the fall in the first place is kind of more important than kind of learning how to fall, probably. You know, I know in martial arts they do all kinds of teaching. You know, if you know how to fall and break yourself this way and catch yourself this way and that way. But a lot of times, especially for older people, you know, if you're falling, it's kind of over before you know it. A lot of times.
But sometimes you can consciously tell yourself to relax and keep your head up and don't land on your hands.
Mm-hmm. Yep, I agree. So yeah, try not to hit your head. But if you can lower yourself down and prevent it in the first place, that's the best thing to do. Any other questions? All right, like I can actually open up the chat here too, I guess.
I have a suggestion.
Sure.
If you can look at the situation you're in and kind of plan for it. For instance, let's say you're going to walk across a road and the road's kind of icy. If you take your hands out of your pockets,
Mm-hmm.
So before you do this, there's a chance you'll have you can keep your balance better with your arms free to move. And so you kind of anticipate the situation you're getting into and you know, take some precautions.
Mm-hmm. Yeah, that's true. That's a good point. So if your hands are in, you can kind of use your arms as like a pendulum or something to get your balance. Like, I don't know if anyone's watched like Mount Marathon when they run down. A lot of the really good runners that are running really fast down the hill have their arms kind of spread out, and what they're doing is they're using these little movements to be able to catch their balance. So if your hands are in your pockets, you know, just those little bit of being able to shift your balance a little bit, you're not able to do. So even though it is cold, if you're on an icier place, just having your hands out while you're walking can help you keep your balance a little bit better. So yeah, that's a good point.
I have a question about using walking poles. Do
Mhm.
they assist a person as they're walking, or does a person tend to rely on them in some way that makes them more prone to fall?
Yeah, that's a really good question. So unfortunately, there have not been a lot of research studies on walking poles. There's been a lot on walkers and canes. I think the perception of a lot of geriatricians is that for a lot of people, probably a walking stick or a walking pole may be better than a cane. It's kind of up. A lot of times with canes, people are stooped way over, and with the walking stick, you kind of hold yourself up a little bit. So I think if you need it, it's probably good. Certainly if you're on an unsteady surface, that can be very helpful. I don't think there's any good studies that I'm aware of kind of one way or another on that, though. It's just kind of something that a lot of geriatricians do recommend. They are something that can kind of take some of the pressure off of joints that are really sore. And we know, like I said, arthritis is something that can cause a lot of issues, increasing the risk of falls. And if you can kind of walking and taking a little bit of pressure off, and it's kind of an extra point of contact with the ground, I think they can be real helpful in certain situations.
Does that also help to increase upper body strength if you're using the walking poles?
Mm-hmm. Yeah, it does seem to. So there's actually a style of exercise that's really important or really popular in some of the Nordic countries. So it's called Nordic Walking. It's basically cross-country skiing without the skis. So you're walking, but you have the ski poles. And there actually has been some studies on that for older people in exercise. And it does seem like it uses more upper body strength. And you can burn more calories for the same level of pressure on your legs. So you can work out harder without, hurting your knees, and you are getting more of a full body workout.
Thank you.
Mm-hmm.
I always look for gravel in parking lots
Mhm,
and try to walk on the gravel.
mhm.
I
Yeah.
have ice bugs boots that have studs on the bottom of them. And I'm wondering whether the studs wear out.
They can, yeah, they can wear out over time, or depending on what kind you get, they can kind of break off. One thing to keep in mind with a lot of those, like the yak tracks or some of those, is if you step on tile on with those, it's just basically like, you know, you had ice on the bottom of your foot. So you got to be really careful. I know I've seen that several times, even just like out at Safeway, someone has like the yak track things, then they come inside on that floor and their legs just slide out from under them. So they're great when you're on ice. If you're on tile, or sometimes they can get kind of caught in carpet, it can actually, if you're wearing them inside, sometimes that's not very good.
These boots actually have studs,
Mhm.
and they have a center small rubber, and I don't know whether that, I'm very, very cautious walking inside
Mhm.
on a tile floor or on a,
Right. Yeah, it's definitely something to be cautious, because people that don't know that sometimes can get into a lot of trouble. If you start trying to run around in Safeway with those on, you can definitely slip.
I have a couple of comments.
Mhm.
I was going to ask about canes and walkers too. But aside from that, certain medications speed up the calcification of cilia in the inner ear. They're notorious for this, and you have to watch out for those. It happened to me, and it really, really shot my balance.
Mhm.
Another thing is the use of alcohol or hallucinogenic drugs. A lot of people use them for pain mitigation,
Mhm.
chronic pain. Is there a balance that you strike between mitigating the pain enough so that you can sleep through the night, for example, and how much damage it does to your balance?
Yeah, it's a good question. So there's a balance with anything. I mean, like those medications I brought up, certainly I have patients on many of those medications. It's not that I would never do them. It's just that there is a balance and you want to be really thoughtful. What I see a lot of times is maybe people have been on some of those medications that can affect the balance for a really long time. And maybe we're starting to get to the point where it's now starting to cause more problems than it has benefits. So sometimes it was a perfectly good medication to start 5 years ago or 10 years ago, and maybe not as much now. So you do kind of have to look at the risks and the benefits. Sometimes as people's kidney function changes, those medications stick around in the body a lot longer. So a medication that would have been a safe dose, you know, a few years ago, now your kidney function is not good. Now that same, even though it's the same dose, the amount your body is sensing is twice what it was before. So yes, there is a balance between not overdoing it, but not underdoing with medications. And I'd say it's probably similar with some of those other things like cannabis. So I've had patients that have got off of very high doses of opioid medications by using cannabis. I've had people that probably have honestly dementia because they're using so much cannabis. So I think it can kind of go one way or the other. As far as the alcohol, I'd say almost no one is better off using significant alcohol to help with sleep. So if someone's having one drink to fall asleep, that's probably not a huge deal, although it could be for some people. As people get older, everyone's a little bit different in how they process that. But if someone's drinking 2, 3, 4 drinks before bed, a lot of times what that's doing is you're not getting good natural sleep. You feel like you're getting sleeping, but you're really just more getting sedated and not good natural sleep. So alcohol is not a good medication in significant quantities to help with sleep, and not really ideal for pain relief either. I think there's probably more promise with cannabis, but there's also not been much studies either. But yes, any of these medications, even a little bit of alcohol or cannabis, for some people is perfectly fine. For other people, it may not be. And a lot of that's the individual person and also the dose.
I think doctors need to study up on the effects of some of the medications they prescribe.
Yeah, I think a lot of doctors haven't had a lot of training in geriatrics and don't realize that there's a lot of changes that go on that make people more sensitive to medications as they get older. So like I said, a medication that's safe when someone's 50, that same medication may not be safe by the time they get to their 80s.
When you talk about cannabis, are you also including CBD for pain?
Well, not as much is what I guess is what I'll say. So mostly I'm talking about THC. CBD, so there's a little bit of evidence for CBD maybe helping with sleep and with anxiety. I've actually had patients that have got off much more dangerous medications just using CBD. Again, that it's not been studied quite as much. I would much prefer my patients to be kind of experimenting with CBD than, a lot of THC. And I'm not saying THC is always bad for everybody, but I think the CBD is probably safer. But I have certainly had patients like with dementia, whose family's given them CBD, and sometimes they feel like it's helpful, but other times they said, they fell 5 times after I gave them 10 drops of CBD or whatever, 2 drops or whatever the serving was. And, they felt like 3 or 4 times the next day. So it's different for everybody. And a lot of it is the concentrations are different. And there's just so much variation that you don't always know exactly what you're getting and how someone's going to respond to it.
I hate to cut this off, but it is a little bit after 5. And we really thank you. This has been a wonderful overview and lots of good information. Thank you so much. Really appreciate it. One other resource I'd like to mention is that the National Council on Aging has a falls-free checkup or falls-free check on 12 questions. It will give you some information on your own risk of falling. So it's just go online, search for falls-free check, and you'll get the National Council on Aging website to try. But thanks again, Dr. McCulley. We really appreciate you being here. And we look forward to seeing folks tomorrow when we're going to be talking about what do you do after you fall and who helps you and how can you prepare for that. So thanks, and we'll see everybody tomorrow, perhaps.
Thank you very much.
Okay, yeah,
Thank
thank
you.
you. Bye.
Great.
Thank you very much.